Hi, my name is Julie Powers. I am a licensed esthetician and aesthetics instructor and a professional makeup artist. I also have a BA in musical theater from Butler University and an MFA in acting from Minnesota State Mankato. I'm here today to talk to you about how to take care of your skin. To understand how to take care of our skin, we first should learn a little bit more about it. Our skin is actually the largest organ in our body, and it's called the integumentary system. It serves as a barrier between our internal workings and the outside world, and it is influenced by a number of factors, both internal and external. Your genetics play a large part in the type of skin you have. There are 4 skin types. They're all genetic. You're born with them. There's dry, normal, combination, and oily. Normal skin is the ideal. It is oil balanced. It is water balanced. The pore size is small. The texture is smooth. It doesn't break out often, if at all. There's a nice resiliency to the skin. This is what we would consider our ideal skin type. So dry skin is found in fairer skin tones, generally speaking. It genetically just doesn't produce enough oil, and because the sebum production is low, the dry skin also loses a lot of water through the surface of the skin through something called transepidermal water loss. So dry skin is tight, it's flaky, the pore size is small to almost invisible. It can be tight and itchy. And this, again, it's a genetic thing. If you're born with dry skin, that's just what it is. You have to supplement that sebum production through your skincare to keep your skin hydrated. Combination skin is something that can be found globally. It's where we have oilier skin in the T-zone, that's across the forehead, down the nose and the chin, and dry or dehydrated skin on the cheeks and the outside of the face. Combination skin can be challenging if you have that because you have to treat both the oily skin in the T-zone and the dryness or dehydration on the rest of the face. Our 4th genetic skin type is oily skin. This is found frequently in deeper skin tones. It kind of gets a bad rap. Oily skin does produce a lot of oil, but it's also thicker and more resilient. It is more common in oily skin to have breakouts, congestion, acne, things like that, and oily skin does have a larger pore size, but it also has a beautiful luminous glow to it. When it's not broken out or congested, the texture is really resilient. It has a lot of elasticity to it, and oily skin doesn't age as quickly. Some of you may be familiar with the Fitzpatrick scale, and what that measures is the skin's ability to tolerate UV exposure. It's a 1 to 6 scale, 1 being very, very pale, always burns, never tans, to 6, which is very, very deep, will always tan, will never burn. It's important to remember that regardless of where you fall on the Fitzpatrick scale, you need a daily SPF of 30 to 50, regardless. Doesn't matter if it's overcast, doesn't matter what part of the world you live in. Everyone is susceptible to UV damage and potentially skin cancer if you don't protect your skin appropriately. So we talk about the Fitzpatrick scale so you have an idea of the amount of protection you need from UV exposure, and we do that because sun damage is the biggest contributor to skin issues. The picture you see on the slide here is the woman in regular lighting and then under a woods lamp. And all of the dark spots on her skin in that black and white photo are hyperpigmentation and sun damage. And as you age, that starts to show up on the outside of your skin. We really want to protect ourselves from that to keep our skin looking nice and youthful for as long as possible. One of the most depressing facts I learned when I was studying to be an esthetician was that 80 to 85% of our visible aging occurs due to sun damage, and 80 to 85% of that happens before you're 20 years old. By the time you're old enough to really appreciate skincare, the damage has been done. So in addition to sun damage, damage to our skin's barrier is another reason why we may be struggling with our skincare or the way our skin looks. The skin's barrier, acid mantle, is made up of water and lipids and intracellular fluids, and that keeps our skin hydrated and protected from the elements. When our barrier becomes impaired through sickness, through overuse of products, misuse of products, sun damage, then things that shouldn't get into our skin get into our skin. We become irritated, we become inflamed, the skin looks rough and dull and is painful. As I've practiced as an esthetician, I have come to learn that when people come in with with irritations and allergies and dryness or dehydration, that the problem is actually an impaired barrier, and that if we can repair the barrier to their skin, a lot of their other problems will come to resolve themselves. So that brings us to sensitive and sensitized skin, which is essentially two sides of the same coin. So sensitive skin specifically tends to be found in people who have Fitzpatrick 1 or 2, so very fair skin that also tends to be dry. Because they don't produce enough oil or hydration in their skin, they tend to have very fragile skin. We see a lot of inflammation in this type of skin, broken capillaries. They tend to have a lot of trouble with product because it doesn't take much to overprocess that sensitive skin. So where sensitive skin is genetic, sensitized skin has all of the same issues but can be found in any skin type, Fitzpatrick 1 through 6. And the difference is that sensitized skin has become that way because external forces have destroyed that acid mantle and the skin is no longer being protected the way it should. If you are having sensitivity issues with your skin, but your skin is generally more normal to oily, then we have to look at what you're doing to it, what you're being exposed to that is causing your skin to become irritated, inflamed, and painful for you. So I want to address a few other skin conditions that might be of concern. The first being premature aging, and that tends to be caused by things like poor nutrition, lack of sleep, stress. It can be medication, sun exposure for sure without an SPF, not using a proper skincare routine. All of those things can cause your skin to age more quickly than it should. While we can mitigate it, prevention is better than trying to fix it. Another really common skin condition is dehydration. 70% of the adult population of the United States is chronically dehydrated, and when your skin is dehydrated, it makes enough oil, but it doesn't make enough water. You want to focus on keeping your body hydrated both internally and topically. There are products that we'll talk about here shortly that will help you do that. But if you're dehydrated, again, that can lead to your barrier breaking down and causing a host of other problems, including sensitization, premature aging, etc. So hyperpigmentation is another common complaint that people have with their skin. It is just discoloration of the skin. It can happen due to sun damage. It can happen because of hormones or medication. And sometimes you can get something called post-inflammatory hyperpigmentation, and that's where you had a blemish and maybe you picked at it, or you just had a severe breakout and the breakout is gone, but you have dark spots or pigmentation where they were, and that can take a while to fade. So I included this slide on healthy habits for your skin. It's pretty simplistic, but these are all things that you can do just from a lifestyle perspective to help you have the best skin that you're capable of. Staying out of the sun is one of the best things you can possibly do for yourself. Don't smoke and have a good skincare routine. All of those things are going to help keep you looking healthy and youthful for as long as possible. So next we're going to talk about specific products, and I'm going to present these in the order that you need them. Cleansers would be the first thing, and you actually need two, a pre-cleanse and then an actual cleanser for your skin. The pre-cleanse is an oil cleanser that will take your makeup off, and we can see some here. On the left is my favorite, that's Dermalogica's pre-cleanse. You put a pump of that into your hand, massage it over your skin, including your eyelids and your lips. It will dissolve all of the waterproof makeup. It will dissolve long-wearing matte lipsticks. It's really, really wonderful. You get a little water on it, it will emulsify and rinse off cleanly. Micellar water is a product in the middle. Micellar water is literally just water with oil in it, but it also makes a really nice makeup remover and is at a really affordable price point, and you can find it anywhere. The last one is a Neutrogena oil cleanser, and it would work similarly to the pre-cleanse. After that, you're gonna need an actual cleanser, and in your cleansers, you really just need something basic to clean your skin. I would probably avoid getting cleansers that have a lot of AHAs, BHAs, retinols. You just don't need it. The ones that I'm showing here are all just foaming gel cleansers. They're very neutral and they're great for just getting your skin clean. Toners are up next. It took me a long time to get on the toner train. So what really got me on board with toners was the analogy of a kitchen sponge. And if you have a dry kitchen sponge and you put soap on top of it, the soap is just gonna sit there. Whereas if the sponge is even and a little bit wet, the soap will absorb in and work better. While our skin isn't a sponge, it does work in a similar way in that if it is well hydrated, the products you're using will be more effective. The purpose of a toner is to hydrate our skin and reset the skin's pH to 4.5 to 5.5, which is where it's supposed to be when you're normal and healthy. We've got some products here. Again, different price points. Dermalogica on the left, the Mario Badescu Cucumber. They also have a Mario Badescu Rose Water that I like quite a bit. Hale and Hush, which is a line specifically for medically compromised skin, and then CeraVe, which is something you can find anywhere. When you're looking for a toner, the primary thing you want to look for is something that's going to be hydrating and restoring. You don't want witch hazel, you don't want sea breeze. Those are frequently called toners, but they really aren't. Those are astringents. Those products have a lot of alcohol in them. They can be very drying, and that's not what we're looking for here. We want something to refresh the skin, to hydrate the skin. Another really nice trick you can do with toners is, should you be sunburned, you need to rehydrate the skin before you can put anything else on it. So using like that Mario Badescu Cucumber Spray or the Rose Water Spray, keep it in the fridge, mist your face as often as you can. Once the skin is rehydrated with water, you can then put on things like aloe or anti-burn products, then those will be effective. But if you put them on top of that dried, burnt skin, it's literally like burning a roast. The product, just like the dry sponge, is not going to absorb into the skin. It's going to sit on top or roll off. So toners can be used for a number of different purposes. They're really great to have on hand. Exfoliants are up next, and these are products that help get rid of dead skin cells on the surface of our skin, leaving our skin smoother and brighter. There are two types, either physical or chemical. Physical involves things like scrubs. The caveat I have for you there is avoid St. Ives apricot scrub. It says apricot, but the scrubby bits are actually crushed walnut shells, which will put micro tears in your skin and cause more damage than help. Chemical exfoliants involve using alpha hydroxy acids or beta hydroxy acid. Your alpha hydroxy acids are things like glycolic, lactic, mandelic acids, and they are water-loving. Glycolic can be a little too strong for Fitzpatrick's 4 through 6, so if you have a deeper melanin skin, you may want to avoid glycolic acid. It's safer for you to choose a lactic or a mandelic that has a higher molecular weight, will penetrate the skin slowly and cause less irritation. Salicylic is generally associated with use for oily or acneic skin, but salicylic acid is also a natural anti-inflammatory. So if you have rosacea or other inflammatory skin conditions, salicylic can be a really great option for you. So really quickly, we'll just take a look at a few over-the-counter exfoliants that you can find. On the left is Dermalogica's Daily Microfoliant. That one is a powder you mix with water. It has rice bran derived scrubby bits in it, so it's very, very gentle and it rinses clean. The tonic in the middle has a lactic or glycolic acid in it. Those tonics are pretty easy to find. Your percentage of your AHA is usually under 10%. You apply it to a cotton pad, apply it to your face, and you don't need to rinse it. That's literally all you do. Very easy to use. And again, you only want to do this 3 times a week at most, once a week or every other week if your skin is sensitive. Treatment would be the next step in a clinical facial. You can do treatment at home. It's also known as masking. You don't need to do it every day. Once a week is plenty. Again, here we have just a sample of some different masks you can find. Sheet masks are not my favorite. They generally only have hyaluronic acid in them. A lot of times they have ingredients that are less than helpful. So if you're going to do treatment at home, look for a professional brand, and you can find masks that are very specific to target whatever it is that you need in your skincare routine, whether it's hydration, whether you need antioxidants, whether you need sebum control. You can find masks that will target your specific skincare needs. Dermalayering is the final step in your skincare routine, and this is something you want to do every time you wash your face, whether or not you do any of the middle steps at all. This is where you're going to apply a serum, a moisturizer, and an SPF. And while serums are optional, the older you get, the more you will benefit from them. They are targeted, concentrated products. They tend to be more expensive, although lines like The Ordinary have serums at a really affordable price point. It doesn't take much to get the job done. You only need 3 to 4 drops of serum them to cover your face and neck. And if you use them consistently for a minimum of a month, you will really see results from those. Your moisturizer comes next, and you want to choose one that's appropriate for your skin type. There's a fallacy that people with oily skin don't need moisturizer, and you do. You just want to choose one that is water-based rather than oil-based. A product like the Neutrogena Hydro Boost is a water gel and will provide your skin with the appropriate hydration without leaving you oily and greasy. You can find moisturizers that have SPF already in them, like the Dermalogica Dynamic Skin Recovery SPF 50 or the Image moisturizer with an SPF. Both of those are wonderful. The Dermalogica one is in their Age Smart line and has anti-aging properties in addition to the SPF sun protection. And the Image moisturizer has a beautiful texture. It smells like oranges and has a strong sunscreen as well. You're kind of killing two birds with one stone. It saves you a little time in your routine, and you're covered with both your hydration and your sun protection. I hope that was helpful for you. It's just the tip of the iceberg as far as skincare goes, but it should be enough to get you well on your way to having beautiful skin as you move through your career.